Hi, I'm Dr. Steve Pinney, and today we're going to be reviewing anterior tibial tendonitis. The anterior tibial tendon is the main tendon that holds the foot up. It runs in front of the ankle joint and inserts into the inside of the foot. With each step, contraction of the tibialis anterior muscle working through the anterior tibial tendon helps prevent the foot from flopping downwards. Over time, this tendon can develop wear and tear, leading to tendonitis. If the anterior tibial tendon becomes inflamed with tendonitis from overuse, aging, or repetitive injury, it may lead to pain and swelling in the front of the ankle, which can be quite frustrating. These symptoms are often aggravated by increased activities, such as prolonged standing or walking. Anterior tibial tendonitis occurs due to wear and tear on the tendon. With age, tendons tend to stiffen and weaken, which help explain why this condition is commonly seen in patients in their 60s and 70s. A tight calf muscle or limited upward ankle motion is also a risk factor, as these factors will cause the anterior tibial tendon to exert more force in order to move the foot upwards or keep the foot in a neutral position. Anterior tibial tendonitis is akin to a rope that stiffens, weakens, and maybe even has some fraying due to increased use over many years. Risk factors for the development of this condition include increasing age, a tight calf muscle, and a sudden increase in activity level. Essentially anything that will increase the repetitive forces the tendon is subject to, or anything that increases the general wear and tear on the tendon will increase the risk of developing anterior tibial tendonitis. Anterior tibial tendonitis can usually be diagnosed just by examining the patient. The tendon can be easily felt when the foot is flexed upwards. If it is painful and swollen, it usually means a tendonitis is present. Sometimes there's a question as to whether there may be a partial or even a complete attritional tearing of the tendon. Weakness in flexing up the foot may be noted if the tendon has ruptured. If the diagnosis is not clear, an MRI may be beneficial. An MRI of a patient with anterior tibial tendonitis will usually show fluid around the tendon and may also demonstrate some partial tearing of some of the tendon fibers. An MRI can also confirm whether a complete tear of the tendon has occurred. It is important to determine if the tendon has completely torn, as the treatment plan for a torn anterior tibial tendon is likely to be quite different than the treatment of tendonitis. The symptoms associated with anterior tibial tendonitis can usually be considerably improved or eliminated with conservative treatment. However, a successful treatment program may take 6 to 10 weeks or longer. And unfortunately, a recurrence of symptoms and even a possible rupture of the tendon remain a possibility in the future. The first phase of treatment is to get the symptoms to settle down. This is done by resting and protecting the inflamed anterior tibial tendon. Relative or even complete immobilization in a boot will usually considerably settle the symptoms in 1 to 2 weeks. The second phase of treatment focuses on reactivating the tendon in a graduated manner so that the condition does not flare up again and patients can eventually return to their normal activities. Physical therapy and a home exercise program can be very helpful. Localized soft tissue mobilization to help break up scar tissue is often beneficial. Stretching to improve muscle flexibility in the calf and the muscles of the front of the lower leg will also be helpful. Strengthening of the muscles with higher repetition, lower resistance exercises is also performed. During this reactivation phase, continued protection of the tendon may be helpful with the use of an ankle brace. Additionally, weight-bearing activity should be increased gradually, as a sudden increase in activity can easily flare up the condition. If symptoms are slow to improve, a corticosteroid injection using ultrasound guidance may be considered. However, a corticosteroid injection is not without considerable risk. This type of injection will predictably improve symptoms, often quite dramatically. However, it also will tend to weaken the tendon, making an eventual rupture more likely. Surgery is usually not needed to successfully treat anterior tibial tendonitis. However, in patients with ongoing debilitating symptoms that have not responded to appropriate conservative treatment, a surgical cleaning out of the tendon may be helpful. This procedure is known as a debridement. In many patients, this debridement surgery may be combined with other procedures such as a lengthening of the calf muscle in order to optimize the results. Commonly, surgery is indicated if the anterior tibial tendon has ruptured. To learn more about a ruptured anterior tibial tendon, click on the link in the description below. I hope that you found this review of anterior tibial tendonitis to be helpful. Wishing you good foot health, I'm Dr. Steve Pinney.